Speaking of the weather, in Hawaii, we're blessed. Great weather all year long. Many of us go running for exercise or participating in marathons or just to feel good. But what happens if your knees are not feeling so good? As a result, you may be suffering from runner's knee. We welcome David Kurihara. He's a physical therapist at the Queen Center for Sports Medicine. And Linda, with him as well, is going to demonstrate some things we should do and should not do. Good morning to both of you.
Morning.
Well, first of all, what is runner's knee? What are some of the symptoms?
So runner's knee, also known as patellofemoral pain syndrome, is the most common overuse knee injury amongst runners, and it's characterized by pain, irritation, or swelling around and or behind the kneecap, which is in the front of the knee. And not only can you feel symptoms with running, but people can feel it with walking, squatting, and even managing stairs. So it affects people of all activity levels.
So as we can see, that's the cause. What are some of the causes? We know what it is now. What are some of the causes?
Some of the causes, there's many factors, but the ones that we see the most of in clinic is number one, people doing too much too soon. So people that are a little inactive, sedentary, and they just start running off the bat like 6 miles on Monday, and they get a lot of poundage on their knees. Running on uneven surfaces, such as loose sand or bank surfaces on the road or on the beach, can cause a lot of strain. Poor running form is another one. And lastly, the most common thing that we see in clinic is muscle imbalances that create bad alignment of the knee. And
please demonstrate.
Show a demonstration. This is Linda, and she's going to show us two motions, a good and a bad position of the knee. So she's going to get in a good motion first. So Linda's in a good running stance right now. She's upright, shoulders, pelvis even. The hip, knee, and foot are all in good alignment. So this is an optimal position. Now we'll show you a bad position.
Okay, good to know. Oh.
So notice how she's a little twisted. The pelvis is higher here, and you see the inward angulation of the knee. This inward angulation of the knee causes a lot of strain on the knee.
Is the depth of her lunge important too?
Partly too, yeah, for shock absorption.
Okay, so how can we prevent it?
So if you're having pain or inflammation, best thing to do is rest, ice, activity modification. Maybe start off with interval training, like a jog, walk, instead of just doing a straight jog. If you have poor running form, you should consult with a physical therapist so we can check their running mechanics and give you tips and strategies to change that. And lastly, if you have a muscle imbalance, which is what most people have, we can prescribe exercises to rectify that.
Okay.
And Linda's going to get into a lunge position. I'm going to just have this resistance band.
Okay.
I'm going to tie it around her leg like this, and I'm going to give her a little pull. And as I give her a little pull, you can see that it goes into a bad angulation. And if I tell Linda to make it straight, now she's using her foot, hip, and trunk muscles to keep that straight. And as she does a squat, now she's training the muscles to keep that knee in the right position so that when she runs, it'll translate to keeping all the muscles active and maintaining good alignment. Which
can all be done with an analysis that you guys can do as well. Very good. That's cool. Interesting stuff. I didn't know all that about runner's knee, but good to know. And there are solutions. Doesn't mean that it's the end of your running career.
Exactly.
Runner's knee. Good to see both of you.
Thank you.
Thank you very much for being here. Thanks to David. By the way, he and the team at the Queen Center for Sports Medicine, they specialize in treatment of sports and exercise-related injuries. They also help active people maximize performance and minimize injuries. To learn more about all of this, go to 691-4449. You can go to KH12.com for all the information. Thanks again.
Thank you.
All right, coming up next, we're going to take a look outside to see how heavy traffic is on this first day back to work.